Welcome to the 2015 Turning 65 Medicare Educational Seminar. This Medicare Educational Seminar is designed to help you better understand Medicare, the Part D prescription drug program, and the types of Medicare health plan options available to you. This seminar does not cover specific Medicare health plans or their member benefits. Medicare has not reviewed or approved of this presentation. Medicare does not review educational seminars. The Turning 65 Medicare Educational Seminar has been reviewed and approved by several Medicare Health Plans compliance officers. There is an audio feature to this presentation which you can activate or mute. Also, there is a Contact Me feature where you can send us your questions about Medicare and you can request help with your Medicare. Thank you, and enjoy the Turning 65 Medicare Educational Seminar. The agenda for the Turning 65 Medicare Educational Seminar includes these topics: a comprehensive overview of the Medicare program. What are your Medicare health plan options? A review of Part D prescription drug benefit. Medicare's star rating program for Medicare Part C health plans. When you can enroll in Medicare and Part D. Your resources to gain more information about Medicare, Social Security, and Medicaid. Hopefully, you will come away from the Turning 65 Educational Seminar with a better understanding of the basics of Medicare. It is important to understand that Medicare and Social Security are two different federal entitlement programs. Basically, beginning at age 65 or earlier if you are disabled, Medicare provides you health coverage. Your prescription drug coverage is available through private insurance companies. As early as age 62, Social Security provides you retirement income. At what age you elect to start Medicare and Social Security is your option. If you have health insurance through your employer, you do not need to start Medicare till you are no longer covered because you retired from your job or your employer eliminated health insurance for its employees. You can start drawing Social Security income as early as age 62 and as late as age 70. Medicare comprises Part A and Part B health benefits. Part B has a monthly premium you must pay when you start Medicare. Some options to consider. Number 1. If you start Medicare and do not start Social Security, then you will have to pay Social Security directly for your Part B premium. Number 2. If you start Medicare and start Social Security, then your Part B premium will be deducted from your Social Security check. Number 3. If you do not start Medicare and you start Social Security, then you do not pay a Part B premium until you do start Medicare. Established in 1965, Medicare is a federal health insurance program and is designed for the aged and disabled. To qualify for Medicare, you must be a U.S. citizen or have a resident visa and in the United States for 5 consecutive years. You must be 65 or older or getting disability benefits for 24 months, or have kidney failure or end-stage renal disease, or approved Social Security disability with a diagnosis of ALS, Lou Gehrig's disease. The federal agency Centers for Medicare and Medicaid Services, CMS, administers Medicare, as well as the Medicaid program. To its types of health coverage. Part A is your hospital coverage, such as inpatient services and skilled nursing facilities. Part B is your medical coverage, such as doctor, lab, outpatient services, DME supplies. Part C is the Medicare Advantage health plans available to you. These Medicare health plans cover the Medicare benefits under Part A and Part B. Many of the Medicare Advantage plans also cover Part D prescription drug coverage. Part D is the prescription drug benefits available to you through private insurance companies, but regulated by Medicare. Medicare does not deliver Part D benefits. We will cover in detail Part A, Part B, Part C, and Part D, so you have a thorough understanding of these components of Medicare. Original Medicare has exclusions and limitations you need to be aware of. No medical coverage outside the United States. No coverage for routine vision, dental, hearing, and podiatry. No coverage for acupuncture, hearing aids, or dentures. No custodial care or nursing home care. Medicare has deductibles, coinsurance, and a Part B premium. Because Medicare does not cover all your health needs, there are financial risks associated with Medicare. If you elect to only have Original Medicare as your health insurance, you should purchase a Part D standalone prescription drug plan. The standalone prescription drug plan will have a cost associated with the plan. When eligible to enroll in Part D, there can be a penalty if you do not elect to purchase a Part D prescription drug plan at that time. This Part D penalty will be discussed later in this seminar. When you sign up for Medicare, you will get a Medicare card that looks like the one on this slide. A couple of important points you need to know about your Medicare card. Your name, as printed on your Medicare card, must be used exactly on any documents that ask for your name on your Medicare card. For example, the card on the slide has Jane Doe as the name. If Jane Doe was to complete a document which asks for her name on her Medicare card, she must put Jane Doe, not Jane R. Doe, adding a middle initial, or Jamie Doe, her nickname, or even Jane Smith, if she got married but did not inform Social Security to get a new card with her new name. Your Medicare claim number may or may not look similar to your Social Security number or that of your spouse. If married and you did not pay into Medicare, working 40 quarters, you could be covered by your spouse if they worked 40 quarters and paid into Medicare. Your Medicare claim number would be that of your spouse, with the letter B following the number. Be aware, there are a lot of variations of the Medicare claim number. If you have questions about your number, you can call Social Security or Medicare. As indicated on the previous slide, Part A eligibility is for those aged 65 or older, or their spouse who paid Medicare payroll taxes for 40 working quarters. The 40 working quarters do not have to be consecutive quarters, just 40 quarters during your working years. Part A eligibility is available for those under age 65 if they have been disabled for 24 consecutive months. For those who did not pay Medicare payroll taxes for 40 quarters and wish to purchase Part A coverage, you can purchase Part A coverage for $407 per month. Because of income and assets, some individuals could have their Part A premium subsidized by a federal program named Qualified Medicare Beneficiary, or QMB. Part A Medicare benefits include hospital coverage for 90 days per benefit period, plus 60 lifetime reserve days of hospital coverage past day 90, inpatient psychiatric care, up to 190 lifetime days, skilled nursing facility coverage, up to 100 days per benefit period, only after 3 days of hospitalization, home health care, not to be confused with custodial care. Home health care is medically prescribed home care by your doctor, for example, physical therapy in your home. Hospice care, which is end-of-life care. A benefit period is defined by Medicare as a benefit period begins the day you go into the hospital or skilled nursing facility. The benefit period ends when you have not received any inpatient hospital or skilled nursing facility care for 60 days in a row. If you go into a hospital or skilled nursing facility on day 61 or more, a new benefit period starts. You would be responsible for the inpatient hospital deductible for each new benefit period. There is no limit to the number of benefit periods. Benefit periods are not on a calendar year. In 2015, Medicare has a Part A $1,260 deductible per benefit period. That means when you check into the hospital, you are responsible for the first $1,260. After the deductible, for each day you are in the hospital per benefit period, from 1 to 60 days, the coinsurance is $0. For days 61 through 90, the coinsurance is $315 per day. And for days 91 through 150 days, the coinsurance is $630 per day. For example, if you are in the hospital for 90 days, you would be responsible for the $1,216 deductible and 30 days of coinsurance at $315 per day. Remember, the first 60 days of the 90 days, there is no coinsurance. For stays in a skilled nursing facility, there is no coinsurance for the first 20 days, but from days 21 to 100, there is coinsurance of $157.50 per day. At age 65, if you elect to join Medicare and subscribe to Part B of Medicare, your Part B premium is deducted from your Social Security check. If you have delayed taking Social Security, then you will mail your Part B premium to Social Security quarterly. If you fail to make your Part B monthly premium payments, Medicare will drop you from Part B coverage. If you delay signing up for Part B coverage at age 65 because you are covered by other credible health insurance, such as your employer's health insurance plan, when you do elect to subscribe to Medicare Part B, you only have 63 days to sign up for Part B. If you do not sign up for Part B within the 63 days, you will have to wait for the Part B general enrollment period, which is from January to March, with a July 1st effective date. Also, there is a penalty for not signing up for Part B. For each 12-month period you delay enrollment in Medicare Part B, you will have to pay a 10% Part B premium penalty for as long as you are on Medicare. If you elect to join Medicare and subscribe to Part B, your Part B premium is deducted from your Social Security check. If you have delayed taking Social Security, then you will mail your Part B premium to Social Security each quarter. Those who do not elect Part B when first eligible but have employer group health coverage can enroll in Part B when they retire without penalty. Unless you have health insurance from your employer or your spouse's employer, for each 12-month period you delay enrollment in Medicare Part B, you will have to pay a 10% Part B premium penalty. Others who refuse Part B when first eligible may elect Part B only in general enrollment period and pay the 10% Part B penalty. Part B will become effective July 1st, following general enrollment. Part B benefits covers the following services: physician services, outpatient hospital services, clinical lab, ambulance, diagnostic tests, X-rays, MRIs, CAT scans, medical equipment, eyeglasses after cataract surgery. In 2015, there is a $147 annual deductible for Part B services, plus 20% of the Medicare-approved amount for services. Your Part B premium is based on your adjusted gross income from your previous 2-year return. For 2015, your Part B premium is based on your 2013 adjusted gross income. In 2015, individuals earning less than $85,000 adjusted gross income or $170,000 adjusted gross income for married, their individual Part B premium is $104.90. You can see by the chart that the individual Part B premium rises with the increase in adjusted gross income. An individual with a $214,000 adjusted gross income, or a married couple with $428,000 adjusted gross income, Each would pay a monthly Part B premium of $335.70. Each year, Medicare will evaluate past two-year tax returns for those on Medicare to determine the adjusted gross income to establish their Part B premium for the current year. Increases or decreases in the adjusted gross income result in an increase or decrease in Part B premium for the current year. Part C refers to Medicare Advantage health plans regulated by CMS. To enroll in a Medicare Advantage health plan, you must be enrolled in Part A and Part B and reside in the Medicare Advantage health plan's service area. Benefit coverage in a Medicare Advantage health plan must be actuarially equivalent or better than coverage under Medicare Parts A and B. Medicare Advantage health plans may include benefits not covered by Medicare Parts A and B, such as dental and acupuncture. Medicare Advantage health plans may include a Part D prescription drug plan. Medicare supplement plans are not covered under Part C and will be covered later in this seminar. Part C refers to Medicare Advantage health plans regulated by CMS. To enroll in a Medicare Advantage health plan, you must be enrolled in Part A and Part B and reside in the Medicare Advantage health plan's service area. Benefit coverage in a Medicare Advantage health plan must be actuarially equivalent or better than coverage under Medicare Parts A and B. Medicare Advantage health plans may include benefits not covered by Medicare Parts A and B, such as dental and acupuncture. Medicare Advantage health plans may include a Part D prescription drug plan. Medicare supplement plans are not covered under Part C and will be covered later in this seminar. There are Part C health plan names you should be aware of, especially their acronyms. Due to some specialty Medicare health plans only available in selected areas of the country, not all Medicare health plan types are listed, and not all of the listed plans may be available in your area. You can find out which health plan options are available in your service area through www.medicare.gov. Health Maintenance Organization, HMO. Network-based doctors, hospitals, and healthcare providers. There are two types of HMO plans. 1. Medicare Advantage Plan with Part D, MAPD, includes Part D prescription drug benefits. 2. Medicare Advantage Only, MA, HMO without Part D prescription drug benefits. Medicare Preferred Provider Organization, PPO plan, plans with in- and out-of-network providers. Some PPO plans also include Part D prescription drug benefits. A PPO plan is not a Medicare supplement plan. Medicare Private Fee-for-Service, PFFS plan. Similar to original Medicare, providers must agree to treat you on a visit-by-visit basis. Some PFFS plans also include Part D prescription drug benefits. Medicare Special Needs Plan, SNP. Special needs plans always include Part D prescription drug benefits and are specialized health plans for those with both Medicare and Medicaid, live in nursing homes, or have certain chronic medical conditions. Medicare Medical Savings Account, MSA plan. Combines a high-deductible Medicare Advantage plan and a bank account. The health plan deposits money from Medicare in your account. The member uses the bank account money to pay expenses until the yearly deductible is met. Medicare supplement insurance is available through private insurance companies that covers the financial gaps in Medicare, deductibles, coinsurance, and copayments. The Medicare Supplement Insurance Benefit Chart details each lettered Medicare supplement plan and its respective coverage of Medicare's deductibles, coinsurance, and copayments. As you can see from the chart, none of the plans cover Part D prescription drugs. If you want drug coverage with a Medicare supplement plan, you must also purchase a standalone prescription drug plan. Plan F covers 100% of all Medicare deductibles, coinsurance, and copayments. Plan F with a high deductible is available from some insurance companies. The high deductible Plan F is significantly lower in price than Plan F without a high deductible. For 2015, the deductible for Plan F Plus is $2,180. Plans M and N with coinsurance and copayments are generally price competitive with other plans. Value-added benefits, such as wellness benefits, are not included on the chart, as each insurance company has the latitude to provide these benefits on a plan basis. Before purchasing a Medicare supplement plan, check with the insurance company as to the value-added benefits available to you. When you join Medicare, besides Original Medicare, you have the option to select a Medicare supplement plan or a Medicare Advantage plan. Outlined are some of the key considerations in selecting the type of plan best for you. 1. A Medicare supplement plan has limited guaranteed issue options, and availability may be based on your health history. A Medicare Advantage plan with prescription drug coverage, MAPD, is guaranteed issue except for end-stage renal disease. 2. With a Medicare supplement plan, you have direct access to specialists, while MAPD plans, you must select a PCP, get a referral for a specialist visit, and you must stay within the designated provider network. 3. Medicare supplement plans have a monthly premium based on your age, plan selection, and your county of residence. Your monthly premium increases over time. MAPD plans have no or low premiums, which vary by county. 4. Medicare supplement plans have copays based on plan selection, while MAPD plans have no or low copays, but the MAPD plans could have coinsurance for services such as radiation therapy. 5. For prescription drugs, with Medicare supplement plans, you must purchase a standalone prescription drug plan. With MAPD plans, prescription drug coverage is included in the plan. 6. Generally, Medicare supplement plans have no or limited value-added services. You must purchase a dental and vision plan for coverage. For no or low premiums, MAPD plans do include value-added benefits such as wellness, fitness, dental, and vision. 7. If you travel outside the United States, for emergency coverage with Medicare supplement plans, you must purchase a plan with foreign travel coverage. With MAPD plans, urgent and emergency coverage is provided for foreign travel. Coverage limits vary by health plan. In 2003, the Medicare Modernization Act was established. To be eligible for Part D, you must be enrolled in either Part A or Part B, or both Part A and Part B. Medicare does not administer Part D benefits. The Medicare health plans can offer Part D prescription benefits through their Medicare Advantage plan, which is termed Medicare Advantage Prescription Drugs, MAPD. Or the health plans can also offer for purchase standalone Part D prescription drug plans. Medicare members with both Medicare and Medicaid are auto-assigned their Part D plan provider. You must select Part D coverage when you are first eligible for Part B, or you will pay a penalty when you do elect Part D coverage. The penalty is based on the national average of Part D premiums. For 2015, that is $33.13. Subscribing to Part D coverage is voluntary, except for those who have both Medicare and Medicaid coverage. These individuals are auto-assigned by their state a prescription drug plan. Even though voluntary, you will pay a penalty of 1% of the $33.13 national standard premium for every month you could have had Part D coverage but chose not to enroll. If you have credible prescription drug coverage through your employer's health plan or through the VA, then you do not have to enroll in a Part D plan. If you are on a Part D prescription drug plan and wish to change to another plan, the Part D open enrollment is October 15th to December 7th. You may not enroll in two Medicare-certified Part D plans at the same time. For example, if you are on an MAPD plan that includes Part D prescription drugs, you cannot enroll in a standalone Part D prescription drug plan. If you do enroll in the standalone plan, Medicare will disenroll you from your MAPD plan and put you on straight Medicare with your standalone plan. All Part D plans must be minimally actuarially equivalent. In other words, they all must have the same basic benefits as required by Centers of Medicare and Medicaid services. The monthly premium varies by Part D drug plans. Based on your adjusted gross income, you could pay an additional amount over the plan premium. The annual deductible, if applicable by the drug plan provider, cannot be more than $320. For 2015, the initial coverage limit or benefit for drugs is $2,960. The enrollee's out-of-pocket cost threshold in the gap or donut hole is $4,700. In 2015, when you are in the gap, you pay 65% of the cost for generic drugs and 45% of the cost for brand drugs. The enrollee's cost share above the threshold, also termed catastrophic coverage, is $2.65 for generic or preferred multi-source drugs, $6.60 for all other drugs, or 5% of the drug cost, whichever cost is greater. Part D income-based premium is based on your 2013 yearly income, single or married. This is the amount you pay in addition to the health plan's monthly premium for prescription drug coverage. For 2015, individuals with less than $85,000 income for individual or $170,000 yearly income for married, their individual Part D premium is $0. You can see by the chart that the individual Part D premium rises with the increase in yearly income. An individual with $85,001 yearly income or married and $170,001 of yearly income, they would pay a monthly Part D premium of $12.30 in addition to the health plan's premium. Each year, Medicare will evaluate past tax returns for those on Medicare to determine the income to establish their Part D added premium for the current year. Increases or decreases in yearly income result in an increase or decrease in Part D premium. You should be aware of some prescription drug terms when subscribing to a Part D prescription drug plan. Medication therapy management, a voluntary program where a pharmacist or other health professional will give you a comprehensive review of all your medications. Formulary. This is a printed listing of the health plan's covered Medicare-approved pharmaceutical drugs. Health plans must cover the basic Medicare-approved drug list, but may cover more. The prescriptions for drugs listed in a health plan's formulary must be filled at the health plan's contracted pharmacy network. Step therapy. In some cases, health plans require a member to first try a more cost-effective alternate drug for a period of time before being stepped up to the more expensive drug. prior authorization. In some cases, for a specific drug, health plans may require the physician to get approval from the health plan to write a prescription for the specific drug. Medicare health and prescription drug plans get an overall rating that summarizes all categories of services and measures into a single star rating. The star rating of the plan's performance makes it easy for you to compare plans. If you're interested in more detail about a plan's star rating, you can look at the health or drug plan's summary scores. A plan's star rating is reviewed each year, and results are available each fall. A plan can get ratings between 1 and 5 stars, ranging from poor, 1 star, to excellent, 5 stars. You can switch to a plan that has an overall 5-star rating at any time during the year. You can only make a switch to a 5-star plan one time each year. There are definite rules when you can enroll in Medicare Part A and Part B and Part D prescription drug plan. These enrollment periods are termed Initial Coverage Election Period, ICEP, and Part D Initial Election Period, IEP. Additionally, each year, CMS establishes the dates that Medicare beneficiaries can change health plans. This period is termed Annual Election Period, or AEP. Medicare members can disenroll from their health plan during Annual Disenrollment Period. There are special circumstances during the year that Medicare members can change health plans. This is termed Special Election Period, or SEP. Your initial enrollment into Medicare Part A and Part B is termed Initial Coverage Election Period, or ICEP. This ICEP begins 3 months before your 65th birthday, includes the month of your birthday, and extends 3 months after your 65th birthday. If you elect not to sign up for Medicare when you turn 65 because you have credible health insurance coverage through your employer, union, or VA, then when you do sign up for Medicare, your timeline to complete your enrollment is different than your initial coverage election period. You have only 63 days to enroll into Medicare after losing your credible coverage, or you will pay a 1% penalty of your Part B premium for every year you did not enroll in Medicare Part B. If you have credible coverage through employer group, union, or VA, Part B enrollment can be pended beyond your initial month of eligibility. Part D Initial Election Period, IEP. For those who are newly eligible for Medicare's Part D prescription drug coverage, the initial election of Part D occurs simultaneously with ICEP. Only one Part D enrollment choice can be made, either a standalone prescription drug plan or one included by enrolling in an MAPD plan. Those eligible for Medicare prior to age 65 will have another ICEP when attaining age 65. The open enrollment period with a January 1st effective date begins October 15th and ends December 7th. During OEP, beneficiaries can stay with their current Medicare plan, or they can add or drop their Medicare Advantage plan and/or drug coverage plan, or return to original Medicare. The annual disenrollment period is January 1st to February 14th, where Part C beneficiaries can disenroll from their MAPD plans and return to original Medicare, and may enroll in a prescription drug plan during that same period. A special enrollment period, or SEP, is for Medicare beneficiaries experiencing unique qualifying events, such as involuntary loss of their employer health benefits or moving to an area where your current Medicare health plan is not available. During SEP, you have one opportunity to change to a Medicare Advantage plan or Part D plan. Those with dual eligibility for Medicare and Medicaid can enroll any time during the year, as can those with a low-income subsidy. Medicare has excellent resources for information about Medicare. You can go to the Medicare website at www.medicare.gov or call Medicare at 1-800-MEDICARE. For help with Social Security, you can go online at www.ssa.gov or call Social Security at 1-800-772-1213. TTY users should call 1-800-325-0778. For questions about Medi-Cal, their website is